Health Director Thomas Shapumba revealed this in response to complaints from the public about the lack of doctors, nurses and ambulances to respond to emergencies. Shapumba singled out the Opuwo District Hospital, which is most affected and where one doctor serves about 50,000 people. The training center forms part of the $5 million budget for hospital upgrades.
A number of health facilities are coupled with a challenge of medical staff, but we have made a submission, to the national level so that the issue can be looked into and considered, so that in the end of the day, we have enough medical staff in our district hospitals. The government or the Ministry of Health has identified the need for the training institution here locally. The purpose is to train local people, particularly the nursing enrolled nurses, so they can be trained locally, and after the training, then they can just be employed again in the region.
About the lack of ambulances, Shapumba said there was no shortage of ambulances and that the only challenge is inaccessibility to rural areas due to the rough terrains. The ministry plans to auction off damaged ambulances and government vehicles to purchase off-road vehicles.
As we know, in the region is very challenging in terms of the geographical, setup, in terms of the rivers, in terms of the road infrastructures, mountains. So some of the health facilities cannot be accessible easily by this quantum Toyota ambulances. They need 4x4 ambulances. Those ones we don't have enough, to go to those remote areas. That is the part of the challenge we have. But generally, we are well catered off. The ones which are in town hospitals, they are properly functioning, all of them.
The region has about 3 district hospitals, 3 health centers, and 22 clinics, serving a population of over 81,000 people. Faith Sankwasa, NBC News, Ochuwarongo.